Thank you for joining me today. To everyone who's been with us throughout the years, thank you so much for your ongoing support, participation, and activism. As always, I appreciate you being here with us today. And for those who are new, welcome. I'm Domb, founder of the Visual Snow Initiative, also known as VSI. VSI is a nonprofit organization dedicated to global awareness, education, resources, patient advocacy, treatment development, and research for visual snow syndrome, or VSS. Affecting an estimated 2 to 3% of the world's population, VSS is a neurological disorder that can impact an individual's vision, hearing, cognition, sensory processing, and quality of life. In 2018, I founded the Visual Snow Initiative after experiencing the onset of visual snow syndrome in 2015, which drastically altered my life. Like many with VSS, I faced a lack of understanding from the medical community, enduring misdiagnosis, mistreatment, trauma, and anguish. Mainstream medicine often dismissed VSS as unreal, leading to further confusion and suffering for patients. Recognizing the need for awareness and support, I organized the first Visual Snow Conference and established VSI to advocate for those affected by VSS and develop solutions while collaborating with global researchers. Whether you experience a mild or debilitating form of the condition, as someone with VSS, I want to remind you that you're not alone and that together we're making a difference. To recap, since I started VSI in 2018, we've produced critical research in 7 different countries that led to the clinical, scientific acceptance of VSS as a distinct neurological condition with both visual and non-visual symptoms, discoveries regarding the biology and pathophysiology of VSS, as well as the development of viable treatment options for VSS symptoms where none previously existed. These studies supporting data and brain imaging have been published in medical journals such as Frontiers in Neurology, Brain Communications, the Journal of Neuro-Ophthalmology, PubMed, and more. We've also created the first diagnostic criteria for VSS, the first global directory of VSS physicians, the first VSS brochures designed for medical professionals and patients available in multiple languages, hundreds of educational videos about VSS for healthcare professionals and patients, newfound awareness for VSS through our multimedia content, and physician-patient resources to improve health literacy, communication, and education regarding VSS. International health organizations like the World Health Organization, Mayo Clinic, and NIH are now utilizing the resources we've created. Additionally, we formed a global research team, which consists of experienced and passionate VSS experts, physicians, scientists, and researchers from around the world. Their areas of exploration include symptomatology, pathophysiology, brain network mechanisms, neurotransmitters, biomarkers, and treatments. Our ultimate goal is a cure for VSS, and along the way, we're trying our best to make the world a more informed, accessible, and understanding place for people of all ages affected by the condition. We've progressed significantly in a few short years, and I know we can continue to do so together. Thank you for being a part of this journey and for all of your support along the way. Today, I'm going to be recapping the latest VSI updates and progress. Let's get started. At the beginning of my VSS journey, even as someone experiencing the condition firsthand, this complex sensory processing neurological disorder was difficult for me to understand and explain to doctors who had never heard of VSS, as well as friends and family. It felt frustrating and isolating, further intensifying many of my VSS symptoms, but specifically depersonalization. After creating the Visual Snow Initiative website, my team and I hoped it could become a hub for everything visual snow syndrome and VSI. I reflected upon what type of information and resources I wished were available to me back then at the start of my VSS journey, what might have made navigating it easier and helped others understand what I was going through. This is the inspiration behind everything we do on visualsnowinitiative.org. We've tried our best to create an accessible and comprehensive website that explains VSS in a way that's easy to understand, regardless of health literacy, and offers a variety of resources to benefit both VSS patients and doctors. We've created photos representing every visual and non-visual symptom of VSS so that symptoms can be easily identified and explained to others. And of course, we also share everything VSI related, such as our VSS research, ways to get involved, and more. We previously shared a video walkthrough of the Visual Snow Initiative website that highlighted all the information we provide about VSS, resources we've created for physicians and VSS patients, as well as newly added features on our website. If you're interested in learning more, please feel free to check out that video. Otherwise, I'll just briefly highlight them here. New key website features include our FAQ page, which is updated regularly and answers a wide range of questions about all aspects related to VSS, VSI, and more. Our VSS misconceptions page, which, as the name implies, dispels common misconceptions or myths about VSS using facts. Our Managing VSS page, which walks you through available treatment options that may help VSS symptoms with supporting clinical evidence and tips for managing VSS symptoms. Our VSS patient guide, which offers step-by-step guidance to anyone that is new to VSS. While it specifically is designed to help individuals diagnosed with VSS, it can also be helpful to loved ones of those with VSS, such as a parent of a child with the condition, spouse, or friend. And lastly, our VSS brochure. Currently available in English and Spanish, it offers a detailed explanation of symptoms, potential causes, methods of diagnosis, and available treatment options. Our brochure can easily be distributed and printed out to be placed in healthcare facilities, offices, practices, and waiting areas. As awareness has grown, we've had a lot of doctors request this, and we are happy that they are spreading awareness for VSS within the medical community. All of these and more are available now on the VSI website. Please feel free to check it out if you feel they may benefit you, or if you simply want to browse and learn more. I also recently announced that I posted Q&A articles on my website, sierradomb.com, and on all VSI's platforms. We asked everyone to submit questions about VSS, VSI, or any appropriate questions about me personally that they had. I answered them to the best of my ability via 5 articles, each categorized by topic. The topics I covered include VSI research and VSS treatments, VSS causes and triggers, activism and educating others about VSS, my own personal journey navigating health challenges throughout the years, and finally, my VSS from the beginning to now. If you're interested, please feel free to check them out. Thank you again to everyone who submitted their questions. I appreciate you sharing your thoughtful inquiries and personal stories with me. Last year, we announced that we were funding the incredible Dr. Francesca Puledda and her groundbreaking research at King's College, in association with our friend and VSS pioneer, Dr. Peter Goadsby. Shortly after that, Dr. Puledda and her team actually discovered the first ever possible biomarkers for visual snow syndrome in history. Previous scanning studies in people with VSS have shown alterations in different regions of the brain and how these interact. However, this was the first study to assess possible molecular changes that could underlie the condition. Supported by VSI and the NIHR Maudsley Biomedical Research Center, this brain scan study revealed the possible biological basis of visual snow syndrome: the abnormal neurotransmission of 2 brain chemicals, serotonin and glutamate. Using a novel approach that combined information of PET imaging on the distribution of different chemical receptors in the brain with functional fMRI analysis, researchers used a receptor-enriched analysis of functional connectivity by targets approach to extract a map of neurotransmitter activity across different brain areas. The 5 brain chemicals examined in this study were noradrenaline, dopamine, serotonin, glutamate, and GABA. Researchers found that in patients with VSS, there were particular differences in the activity of serotonin and glutamate networks in specific areas of the brain. analysis showed that VSS patients had reduced functional connectivity in the serotonin networks of the visual cortex, insula, temporal pole, and orbital frontal areas of the brain compared to healthy controls. This reduced connectivity in serotonin networks was also seen in migraine patients with aura, suggesting a possible biological link between VSS and aura, although they are two distinct conditions. These findings suggest that serotonin activity in VSS patients may be influencing the integration of complex sensory information. Additionally, there was less synchronized activity or functional connectivity in the glutamate networks of the anterior cingulate cortex, or ACC, in those with VSS compared to healthy controls and those with migraine. For those who may not know, the ACC is a hub for thinking and top-down control over sensory inputs. This different pattern of activity could represent an interruption in the filtering and integration of visual information. As for the other neurotransmitters, the results did not find any differences for them. The insights gained from Dr. Puledda will guide her research going forward, and she hopes to use these biological targets to identify a pharmacological treatment after the biology and pathophysiology of the condition are further understood. VSI will be supporting her ongoing research, and as she and her team continue their efforts, we will continue to share updates with you via our website, newsletter, and our social media channels. For further details about this groundbreaking discovery, please feel free to check out the many articles about this on our website in the News and Research section. As many of you who visit our website, subscribe to our newsletter, or follow us on social media may already know, in collaboration with Dr. Schankin and Dr. Klein from Bern University Hospital, VSI is supporting a study exploring neuromodulation for VSS. This research investigates how transcranial alternating current stimulation can modulate overactive neural networks in the brain, potentially leading to new treatment options for VSS. Dr. Schankin and Dr. Klein's techniques aim to reduce various common VSS symptoms, including visual snow/static, palinopsia, entoptic phenomena, photophobia, and nyctalopia. The underlying idea behind VSS is that multiple neural networks in the brain remain overly active, bombarding the visual system with an excess of information. However, their approach offers the possibility of modulating these networks. Dr. Schankin and Dr. Klein's primary goal is to pinpoint the specific areas in the brain where something isn't functioning as it should. And to achieve this, they are blending various diagnostic markers with a treatment-oriented methodology. Their study will begin with comprehensive visual tests, MRI, and EEG measurements. Dr. Schankin and Dr. Klein are particularly interested in observing how this stimulation affects VSS symptoms, influences performance in tasks, and whether there are alterations in EEG patterns in patients with VSS. Dr. Schankin and Dr. Klein discussed their work and collaboration with VSI in our previous video series together. Many of you may have already signed up to participate in their study after seeing our announcement that we were seeking volunteers on our website, newsletter, and social media. So thank you so much for your participation. Dr. Schankin and Dr. Klein have continually been publishing status updates about their ongoing work, which we will continue to share on VSI's platforms, as well as any new developments along the way. MBCT has been recently modified by neurologist, neuro-ophthalmologist, consultant for St. Thomas's NHS Foundation Trust and Moorfields Private Eye Hospital, and Vice President of the UK Neuro-Ophthalmology Society, Dr. Sui Wong, to treat both the visual and non-visual symptoms of VSS. In her open-label feasibility study titled Visual Snow Syndrome Improves with Modulation of Resting State Functional MRI Connectivity After Mindfulness-Based Cognitive Therapy, Dr. Sui Wong and her investigative team's MRI brain scans, patient reports, and expert analyses have revealed that MBCT, when modified for visual snow syndrome, can effectively improve visual symptoms by targeting and modulating dysfunctional visual networks in the brain, impacting neurotransmitters and inducing neuroplasticity. and regulates neurotransmitters like serotonin, which, as Dr. Puledda and her team at King's College discovered, is a crucial brain chemical associated with the biological basis of VSS. Additionally, MBCT can also help reduce the activation of the body's stress response system. This can result in lower levels of stress hormones such as cortisol, which have been implicated in neurodegenerative processes and cognitive decline. Moreover, it can help regulate the functioning of the limbic system and have an effect on the activation of the body's endogenous opioid system, allowing individuals to process sensations without becoming overwhelmed by them. All of this can be helpful for sensory processing disorders that affect cognition like VSS. Dr. Sui Wong has modified MBCT for VSS, now termed MBCT Vision. In addition to the areas addressed using standard MBCT, evidence has also demonstrated that MBCT Vision can help reduce visual disturbances such as visual snow/static, photophobia, trailing phenomenon, and visual aura. MRI scans have demonstrated a positive alteration in the brain's visual network following MBCT Vision, validating its efficacy. Dr. Wong's pioneering research represents the first investigation of a cognitive behavioral and mindfulness-based intervention within the VSS patient population, garnering support from organizations like the North American Neuro-Ophthalmological Society, or NANOS, and VSS expert Dr. Owen White of Monash University's Ocular Motor Research Team.
I have to be honest and say that I had not met Sui prior to her presentation at NANOS, and at that meeting they had a session that was more or less dedicated to visual snow syndrome. Sui presented her work, which showed that using mindfulness techniques, which I believe were based on the Oxford mindfulness programs, she was able to demonstrate that over a period, I think it was 8 and 12 weeks or 8 and 16 weeks, that there was a significant improvement in patients with visual snow syndrome. And let's be clear here that what we're trying to do when we treat anybody is to make them feel better. Almost everything else is irrelevant. So the fact that she could make them feel better with mindfulness was a big step forward on its own, without anything else being considered. But she had combined this with functional MRI and showed, as has been shown with mindfulness in the past, that there were actually changes in functional connections within the brain. So in some way, shape or form, we're modifying the programming because the structure can't change. The actual hardwiring cannot change, but the software programming can change. Now, I found that incredibly exciting to the extent that I sought Sui out and had a long discussion with her afterwards. I thought it was the most exciting step forward in visual snow that I'd come across in all the time that we'd been working in the area. You can't make any criticism of the work because it was a pilot study, and so it was a small number. But it was statistically significant, okay? And you can say that statistics are to scientists like a lamppost is to a drunk man, used more for support than illumination. However, they really are valid, and her figures were solid, any way you looked at them. Needed to be validated with a much larger study, okay? And that's what she's in the process of doing now. Again, I would prefer if the study was going to be done with functional MRI all the time as well, but that's also quite expensive. And in the long run, as I said, functional outcomes are what's important, and she's continuing with the functional study on a significantly larger number of patients. The main benefit of the functional MRI is that it demonstrates that we are modifying programs, and that modifying programs is associated with modifying perception and function. So that more than that, we've never really understood entirely which part of which network is primarily responsible for the generation of all of the symptoms of visual snow syndrome. And I suspect that there are different networks that are responsible for different parts. But the fact that we can modify functional connectivity implies that the programs are being changed. And that's I think, the main value of the study. I prefer the mindfulness MBCT study because it's very physiological. And I think that that this is visual snow syndrome, as I've said, is, I believe, an abnormality of function predicated on impaired software programming. And this is the one thing that specifically addresses underlying programming from other studies as well as from SWI's early studies. Now, there have been other attempts at looking at this, 40 hertz stimulation, magnetic stimulation of cortex, etc. And so far they've just failed. It doesn't mean that they might not have an effect, but they're harder to access, and they haven't been as successful, or we haven't got the right paradigms. Now, with the mindfulness, firstly, you could do that anywhere. Secondly, the cost of doing it is minuscule. Thirdly, it seems to be effective. So I'm really optimistic that all of the criteria for an easily distributed, effective therapy are met. It just needs validation. And I'm optimistic on the basis that the science behind it is solid.
Building upon their initial findings, Dr. Wong and her team, in collaboration with VSI, are conducting a randomized control trial to assess how MBCT vision can enhance the brain's visual network, potentially mitigating VSS symptoms in a larger patient cohort. Additionally, blood samples from participants may unveil anomalies specific to the VSS patient population. Through collaborative efforts with VSI, global researchers like Dr. Puledda, Dr. Schankin, Dr. Goatsby, and Dr. Wong build upon each other's collective studies to maximize comprehensive insights into VSS, what alters the brain, and which systems are involved. To learn more about MBCT vision and study participation, if you're interested, please visit the dedicated website at mbct-vision.co.uk, or you can also contact Dr. Wong and her research team at research@mbct-vision.co.uk. I'm happy to announce that the Visual Snow Initiative has funded a new collaborative study investigating possible medication to treat visual snow syndrome. Our aim with this study is to explore whether a pharmacological intervention can safely target the specific deficits associated with VSS, alleviate visual symptoms, and enhance the quality of life for VSS patients. This groundbreaking research is a collaboration between our global research team, which includes accomplished pioneers and experts in VSS research, neurology, and neuro-ophthalmology. The principal investigators for VSI's new VSS medication study include Dr. Peter Goatsby, Dr. Francesca Puledda, Dr. Christoph Schankin, and Sarah Eschliman. Identifying medication with therapeutic potential for VSS treatment could mark a significant breakthrough in clinical practice. The insights gained from this study may also have far-reaching applications beyond VSS, including other conditions such as HBPD, which also involve visual disturbances and hallucinations. Should researchers identify an effective medication, it could lay the foundation for the first ever pharmacological treatment options for VSS patients. This new clinical trial will be taking place at University Hospital of Bern, Department for Neurology in Switzerland. Contingent upon the submission of an ethics application and approval from Swissmedic, study recruitment will begin thereafter. The expected completion of the study is July 2025. Administration and side effects will be carefully monitored by VSS researchers with expertise in the condition to ensure participant safety. They will take regular measurements of VSS severity, symptom reduction, quality of life, and side effects. Despite intensive efforts, the development of effective pharmacological therapies for VSS has remained a challenge. Medications that have been tested were deemed ineffective by researchers, typically making symptoms worse or inducing no changes. Moreover, many people with VSS attribute the onset of their condition to the use of medication. While some individuals with VSS have expressed that there are medications that have helped them, no clinical evidence supports an effective pharmacological treatment for VSS. Additionally, these same medications make symptoms significantly worse for others and are even often associated with the onset of VSS. For more information regarding this, please feel free to access the FAQ page on the VSI website. But essentially, researchers required additional insights into the biology and pathophysiology of VSS before identifying possible targeted and effective treatments. Studies funded and supported by VSI have helped discover new critical information about visual snow syndrome's biology, pathophysiology, symptomatology, and its mechanisms as a network disorder. By comparing the distribution of receptors in different brain regions and functional connectivity patterns, a recent study was able to identify alterations in serotonin and glutamate neurotransmitter systems that may contribute to the pathophysiology of VSS. In this new clinical trial, researchers will be investigating the potential efficacy and safety of medication that can target the very specific deficits associated with VSS. For further details about this VSS medication study, participation, or any future developments, our global research team will keep us informed whenever more information becomes available. As always, we will continue to share updates via VSI's website, newsletter, and social media channels. Thank you so much for your ongoing support. The Visual Snow Initiative actively funds and supports research being done on both pharmacological interventions or medication and non-invasive treatments for VSS. Just as everyone's symptoms, associated feelings, and journey may be different, so are preferences regarding treatments and methods of managing the condition, as well as research. We always take these factors and patient safety into consideration. We maximize our research efforts through global collaboration and by studying multiple areas related to VSS simultaneously, such as biology, pathophysiology, and underlying brain network mechanisms. Researchers have different areas of interest and expertise. Working together helps us establish a larger, comprehensive understanding of VSS and possible solutions at a faster rate. The expansion of diverse and viable treatment options is important in order to accommodate the various needs, different symptoms, medical histories, safety, and preferences of the global VSS population. The experience of visual snow syndrome, or VSS, as well as its associated symptoms, varies greatly amongst individuals, leading to different perceptions of its impact on quality of life. Some attribute the onset of VSS to medications, especially those targeting the neurological system. Consequently, preferences for pharmacological versus non-invasive treatments may emerge. People may favor medications due to past positive experiences or belief in their efficacy. Conversely, others want to avoid medications, especially those who experience the onset of VSS after taking them, fearing side effects, or worsening symptoms. Concerns about dependency or tolerance can also influence this preference. Non-invasive treatments appeal to some because they address the physical, emotional, and social aspects of health with fewer risks and dependencies. Cost and accessibility also play significant roles, with variations in healthcare systems and regulations across countries affecting treatment availability. Conducting studies to explore treatments for VSS requires researchers equipped with funding, access to testable interventions, both pharmacological or non-invasive, and expertise in visual snow syndrome. Not all medical professionals, healthcare entities, or pharmaceutical organizations possess these requisites. Despite the recent scientific validation and increased awareness, education, resources, and studies for VSS, only a handful of global researchers specialize in the condition. We support the multifaceted and comprehensive work of researchers with expertise in VSS. They're considerate of the complexities of VSS, as well as how any tested treatment modalities can potentially impact the health of study participants and interact with the underlying mechanisms of VSS. The expansion of available, diverse, and viable treatment options for VSS enhances our ability to effectively accommodate the various needs, symptoms, and preferences of the global VSS population. Visual Snow Initiative research efforts are led by experienced, diligent, and passionate VSS researchers who conduct comprehensive studies exploring various aspects of the condition. A broad focus across multiple areas is maintained to optimize global research and ensure accessibility to potential treatments, both pharmacological and non-invasive. Through these endeavors, it is important to remain vigilant about the range of symptoms and prioritize the safety and well-being of individuals with VSS. While we work towards a cure, advocating for access to various types of treatment options is crucial so that patients who have reported VSS as negatively impacting them can experience relief from symptoms and/or improve quality of life in the interim. Individuals can make informed decisions regarding their health by choosing treatments that align with their symptoms, comfort, and needs along the way until a definitive cure for VSS is found. I'm excited to announce the launch of our new video support group for visual snow syndrome. The Visual Snow Initiative and the ANCAN Foundation have partnered together to offer the VSS community face-to-face support and interpersonal connection by hosting virtual, peer-moderated support groups. This marks the inception of the first ever live and interactive video chat support platform specifically for individuals affected by VSS. For years, I felt the weight of isolation, not knowing anyone else with VSS or a doctor who truly understood what I was going through. Those feelings of frustration and solitude were replaced with catharsis and relatability once I began meeting other VSS patients and VSS-informed medical professionals from around the world. In fact, I still remember the relief I felt when I spoke face-to-face with the first person I ever met who also had VSS, which was Matthew Renzi. And also the first doctor, being Dr. Peter Goatsby, who finally diagnosed me with VSS after years of agonizing unknowns and marginalization. I want to provide assurance and comfort to others with VSS that you're not alone in your struggles. While having VSS may not be the same exact experience for everyone, many of us often share similar journeys and symptoms. Our new video chat support group offers an additional opportunity for people with VSS and their loved ones worldwide to connect face-to-face, relate and learn from one another, to build understanding. There are millions of people around the world affected by VSS, but most of us seldom have the opportunity to meet someone with the condition in our daily life. Finding someone with VSS in your immediate area can be challenging. Many people with VSS, especially those who are born with it, may not even realize they have a neurological disorder. Moreover, some people who are aware of their symptoms may have never heard of the term visual snow syndrome and have yet to discover that their condition and symptoms actually has a name. Symptoms of VSS such as visual snow, visual disturbances, derealization, or depersonalization can contribute to feelings of isolation and separation from the world. Many of us may feel alone in our respective local communities, but together we can unite as people affected by VSS from around the world. Everyone affected by VSS is welcome to join our virtual VSS support group, whether you have the condition or are a loved one of someone who does. Our group focuses on not just the physical symptoms of VSS, but how it can affect your mental health as well. Moderated by individuals with VSS who understand our struggles firsthand, this is a safe space where people of all ages affected by VSS can relate to one another and share experiences, tips, or other important topics. Our virtual VSS support group is currently being moderated by Brianna, Leah, and Amber, all of whom have VSS. If you'd like to learn more about them, their bios can be found on both VSI's website and platforms, as well as the ANCAN website. Additionally, if you don't feel comfortable with video, you also have the option to call into the support group. If you do call in, though, we kindly ask that you display your first name in the room. That way, the moderators know who is speaking and they can properly address you. Moreover, VSI, ANCAN, and our moderators all kindly ask that you please be respectful of everyone in the group, as well as their feelings and experiences. Bullying, harassment, and disparaging language are not allowed. If you're interested in joining VSI and ANCAN's virtual support group for visual snow syndrome, please feel free to visit the Visual Snow Initiative website, visualsnowinitiative.org, or the ANCAN website, ancan.org. There, you'll find the schedule for our upcoming meetings, how you can join, and more information. Having VSS can be challenging at times, and it may be hard to find someone else with the condition in your area. Whether you want to meet others with VSS face-to-face or are seeking support, we want to remind you that you're not alone in this. We can communicate together, help each other, gain insights from one another's experiences, and learn more about the diverse global impact of VSS. Thank you, and we hope you'll join us there. Dr. Peter Goatsby, Dr. Owen White, and I have been working together to get visual snow syndrome recognized by the World Health Organization. If approved, the proposal we have submitted to them, accompanied with scientific evidence and supporting testimony, will grant visual snow syndrome its own international classification of diseases, or ICD code, for the first time in history. This milestone will offer numerous significant positive outcomes for individuals affected by VSS, as well as the global scientific and medical communities. For one, VSS can finally be solidified as a legally recognized, legitimate, and distinct neurological disorder on a global scale. In addition, healthcare services related to VSS can now become eligible for insurance coverage and reimbursement. Given the high prevalence of marginalization and misdiagnosis, which results in trauma that most people with VSS, such as myself, have had to endure, this vindication will help establish a brighter future with better healthcare outcomes for VSS patients. Additional benefits include accurate and standardized coding using the ICD to ensure VSS patient safety, reduced risk of errors and misdiagnosis, appropriate and timely care, increased categorized and analyzed data from global sources to facilitate more VSS research and clinical trials, insurance and reimbursement, which I briefly touched upon before, standardized classification and coding of VSS and its related symptoms, ensured consistency in how VSS is documented, improved data accuracy and clinical documentation, epidemiological surveillance, global health statistics related to VSS, integration of VSS into health information systems, clinical decision support, public health policies, and planning for VSS, and further advancements in medical science. If you're interested, you can follow along with our journey to get an ICD code for VSS on either the Visual Snow Initiative website, visualsnowinitiative.org, or my personal website, sierradomb.com, where I share more personal insights based on my direct involvement and efforts related to this process. We have been sharing what the ICD process is like from start to finish, including writing and submitting our proposal, gathering evidence, supporting testimonies, numerous reviews by global physicians and scientists, voting from WHO's medical and scientific bodies, such as the Medical and Scientific Advisory Committee and the Classification and Statistics Advisory Committee, as well as the progress we are making along the way. It is a multifaceted, rigorous, and lengthy process, but Dr. Goatsby, Dr. White, and I are unwaveringly dedicated and passionate about getting an ICD code for VSS. We will continue to share all updates we receive from the World Health Organization regarding our proposal. We hope they ultimately agree with us that VSS should have its own ICD code, a historic and first-of-its-kind achievement that will not only solidify VSS as a real condition forever and provide tremendous vindication to everyone who is doubted or mistreated, but it will also offer new significant benefits to people affected by VSS worldwide, ensuring that future generations will not have to go through what we did. In addition to our efforts to get VSS its own ICD code, our new ANCAN Visual Snow Syndrome video support group, our new website features, and my Q&A articles, we have funded and are currently funding multiple types of research studies exploring various aspects of VSS, which are led by our global research team. There are several available methods that may alleviate VSS symptoms that are supported by clinical evidence, including MBCT, NORT, and other helpful strategies related to brain health that can be found on the Managing VSS page of our website. However, we are also currently researching both pharmacological interventions or medication and additional non-invasive interventions. The expansion of available, diverse, and viable treatment options for VSS is important to effectively accommodate the various needs, different symptoms, medical histories, and treatment preferences of the global VSS population. The safety and accessibility of these interventions are also important considerations. We try our best to maximize global research efforts by collaborating with multiple researchers worldwide who are studying various aspects of VSS, such as biology, pathophysiology, network mechanisms of VSS, and different types of possible treatments. This allows us to gain further knowledge about all facets of VSS that we can share and, importantly, create more resources to help VSS patients as soon as possible. On visualsnowinitiative.org, we list all the specific information regarding what type of studies we are currently funding or have funded, the methods that are being used, and which researchers are involved, but I will briefly summarize them here as well. The current areas of study for VSI-funded research include identifying biomarkers and further understanding those which have recently been identified, for example, abnormalities in serotonin and glutamate neurotransmission, understanding the pathophysiology and underlying mechanisms of VSS as a network disorder, and then using this data to identify potential safe, targeted, and effective treatments for VSS. This includes both possible medications or pharmacological interventions, as well as additional non-invasive interventions. The methods involved include brain imaging using the most powerful state-of-the-art neuroimaging techniques, including a 7 Tesla MRI, positron emission tomography as well, or PET imaging to test the distribution of different chemical receptors in the brain, receptor-enriched analysis of functional connectivity by targets, which is also called a REACT approach, also utilizing mindfulness-based cognitive therapy modified for VSS symptoms to alter the brain's visual network and neural pathways to alleviate symptoms, also blood samples, electroencephalography or EEG, neuromodulation, neurooptometric rehabilitation therapy or NORT to strengthen visual function, alleviate symptoms, and improve quality of life, visual tests, transcranial magnetic stimulation or TMS, or repetitive transcranial magnetic stimulation known as rTMS. The principal investigators for these VSI-funded studies include Dr. Peter Godesby, Dr. Francesca Puledda, King's College London, Dr. Christoph Schankin and Dr. Antonia Klein of Bern University Hospital, Dr. Sui Wong of Guy's and St. Thomas's NHS Foundation, and Dr. Victoria Pilak of University of Colorado. Funded by VSI in 2019 and delayed due to the pandemic, Dr. Pilak has stated that her study on rTMS for VSS is still ongoing, and we will continue to update you as we receive word from Dr. Pilak and her team. I hope this recap helps. As mentioned, if you are interested in learning more, further details can be found on visualsnowinitiative.org, specifically our news and research page, but there's also additional helpful information available on the other web pages too. My team and I appreciate you tuning into this video to learn about the latest VSI updates and milestones for VSS. To stay updated on the latest information about visual snow syndrome and the Visual Snow Initiative, as well as additional resources and all the studies we are funding, please feel free to visit our website, visualsnowinitiative.org. Thank you so much for your continued patience, activism, and support. Bye.